Hey students, welcome to Micromed Education, and today we will discuss regarding antimicrobial susceptibility testing as well as antimicrobial stewardship program in brief. This slide shows this is Alexander Fleming, and he discovered the first antibiotic, that is penicillin. This is a brief classification of antibiotic. We are not going in detail, but one has to remember the beta-lactam includes penicillin, cephalosporins, monobactam as well as carbapenem. When you want to do an antimicrobial susceptibility testing, there are various methods. There are phenotypic methods, there are genotypic or molecular based method as well as mass spectrometry. The most frequently used are the phenotypic methods that we'll discuss. So basically this type of plate with the antibiotic disc are present on this. Students often do the mistake and mention it's not antibiotic susceptibility testing, rather the antibody susceptibility testing. Here the discs are made of antibiotics, so the terminology is antibiotic susceptibility testing. Muller-Hinton agar is generally used for this. There are certain reasons for that. It has an excellent batch-to-batch reproducibility. It is non-selective and non-differential media, has low level of inhibitory substance, and ensure a clear and measurable zone of inhibition. These are called zone of inhibition. Based on that, you can interpret with the breakpoints whether the organism is susceptible, intermediate, or resistant to that particular antibiotics. Now there are various phenotypic methods. So the first one is the disc diffusion method, on which the Muller-Hinton agar plate is lawn culture with the organism and the discs are placed. Then comes the MIC methods. So this is e-test. This is microbroth dilution, broth dilution, agar dilution, and this is a Vitek 2 compact system for diagnosis of MIC. So what do you mean by Kirby-Bauer diffusion method? The plate with the various antibiotic discs is called as Kirby-Bauer diffusion method, and the zone of inhibition can be measured with the help of a scale or one ear caliper. Similarly, a stroke method is also used, in which two different strains are used with the same antibiotic, so one can compare the zone of inhibition of either of each. The MIC detection method, so as we discussed, when you do a lawn culture on Muller-Hinton agar and place a strip which has graded antibiotics, so there will be a zone of inhibition which is like an eclipse. That's why this is called as e-test or eclipse test. And the lowest portion where it intersect is called your MIC, that is minimum inhibitory concentration. What is the definition of MIC? Is lowest amount of the drug that stops visible microbial growth in vitro. So this is a microbroth dilution method, microtiter plate, which is used for ELISA. The same can be used for this method, but here the microtiter plate does not coated with any antigen or antibody. These are plain, and serially dilution of the antibiotic is prepared and then it is inoculated with the test organism to check for the MIC. Similarly, graded diffusions, graded concentration of antibiotic is used for the preparation of agar media and check for this is called agar dilution. The molecular method is basically done by PCR, and here we check the gene like MAC gene for MRSA. Now, sometimes this question is asked, what is BMQ? BMQ is breakpoint to MIC caution. It is a ratio of susceptible breakpoint divided by the MIC, which we have already discussed how to measure it. So, higher the BMQ of your particular isolate, better is the MIC. Will not go in detail, just remember the definition. Now, the organism, what do you mean by phenotypic, intrinsic or acquired resistance? Pardon the spelling here. The intrinsic reason is innate resistance of an organism for that particular antibiotic. However, the acquired is the isolate or the organism has acquired it by mutation or horizontal gene transfer. There are certain organisms, they are intrinsically resistant to that particular or antibiotic. So this is the table. One should remember it. And the acquired resistance, like this in gram-negative bacilli, there are multiple mechanisms. First, there is a decreased uptake because of porine loss, or the drug is entered but it will be effluxed out from the efflux pumps. There is an enzyme that is present which hydrolyzes the antibiotic, like beta-lactamase enzyme, and there is a modification of the target. Like in case of MRSA, it is penicillin binding protein is converted into penicillin binding protein 2A. So the penicillin cannot bind, hence act. Now, in brief, what is AMSP? AMSP is Antimicrobial Stewardship Program. The definition of it, AMSP is, it is the right antibiotic for the right patient at the right time with the right dose with the right route, causing least harm to the patient. Just now remember the definition of AMSP and antibiogram. What is antibiogram? It is an overall profile of an AST, that is antimicrobial susceptibility testing of a specific organism over a battery of the antimicrobial agent as mentioned in this tabular format. This is prepared by microbiology department. Every year they have to prepare and distribute it to the clinician. What is the function of the antibiogram? It guides the clinician for selecting the best empirical antibiotic based on their susceptibility testing, and it also helpful for the monitoring the trends of the antimicrobial resistance. Now we'll discuss in brief regarding MRSA. MRSA is methicillin-resistant Staphylococcus aureus, in which it is due to MAC gene. There is a change of penicillin binding protein to PBP2A. We already discussed. So the protein has changed. So now any beta-lactam cannot bind. It's not only for the penicillin group. So all beta-lactam, including the 5th generation of cephalosporins, all cannot, except 5th generation of cephalosporins, cannot act against methicillin-resistant Staphylococcus aureus. 5th generation can act. So here the drug of choice becomes the vancomycin. However, what is MSSA? It is a methicillin-sensitive Staphylococcus aureus. Here the oral syphons can be used. But remember one important thing. Vancomycin has poor effect against methicillin-sensitive Staphylococcus aureus. What is ESBL? ESBL is extended spectrum beta-lactamase, and it is resistant to first, second, and third generation as well as 4th generation of cephalosporins and monomectams, but excluding cefamycin, and they are sensitive to beta-lactam and beta-lactamase combination, which would be the drug of choice. Thank you so much.